Hello everyone, I'm Shuzhen Wu. My research topic is using artificial intelligence for the early detection of microprogression of pressure injuries in hospitalized patients, a preliminary nursing perspective evaluation. This is the outline of my report. Pressure injury, as an important measurement of nursing quality and often occurs within the first 24 to 96 hours of admission to hospitals. Once the hospitalized patient suffers a pressure injury, in addition to prolonging the hospital stay, increase the risk of infection and life-threatening, it poses a huge challenge to clinical care nurse and increase the cost of care. Our study aims to establish a predict model for the early detection of pressure injury microprogression from the perspective of nurses. The aim of helping the clinical nurse to evaluate and monitor the effectiveness of pressure injury care and enhancing the quality of care. This study was conducted from August 26, 2020 to January 23, 2021 at an internal medicine ward of Medical Center in Northern Taiwan, including 31 subjects who were hospitalized with sacral pressure injuries. The experimental work of this research included the following steps: design of standard scale, image collection, definition of pressure microprogression, image pairing, labeling, pre-processing, and model establishment. I will briefly explain in order. To control the content, angle, and distance in the image collection, we prepare 15 different standard scales. A senior nurse determined the standard scale size at the initial pressure injury evaluation. The scale was placed on the pressure injury after wound care each day, and the photo with the frame was taken with a smartphone. A total of 377 photos were collected. Our pressure injury microprogression is defined as the inconspicuous change in pressure injury characteristic by before and after 24 hours were classified as better, worse, and same. If there is any inconspicuous change toward healing, it is classified as better. Conversely, toward deterioration is classified as worse. Without any inconspicuous change, it is classified as same. The image taken before and after 24 hours were matched in pairs. 346 pairs were obtained for standard scale. 3 senior wound care nurses evaluated and labeled the image pairs. The label result was determined by the majority vote. In the case that each category received 1 vote, the final decision was made by a plastic surgeon, and final result was taken as gold standard. In the image pre-processing stage, the prospective corp was run in Photopea, an online photo editor, with 2 pair standard scales photo. It was then visualized in sure that the 2 pairs photos share a common positioning point by rotation and trimming. And 2 new images were obtained as output after editing. The 2 new images were loaded into the software Python Pillow library, and resize 2000 by 2000 was run to align them. Then, subtract today's image pixels from yesterday's image pixels to form a microprogression image. A total of 346 microprogression images were obtained. For model establishment, 90% of microprogression images were used a training data set, and the other 10% was used a validation data set. The training data set was loaded into a teachable machine for model training. After model training, the validation data set was imported into the model to verify the performance of the model. In the results section, the average age of 31 subjects was 72 years. The average length of hospital stay was 23 days. Most patients have stage 2 pressure injury. In the 346 pairs, 146 pairs were labeled as better, and 84 pairs were labeled as worse. In terms of model performance, in the test data set, our model demonstrated the highest accuracy of 89%, and the accuracy of the validation data set was 59%. In the discussion session, in the preliminary evaluation, the model achieved an accuracy of 89%. However, the accuracy for validation data was much lower than that for the test data, possibility due to overfitting caused by the small sample size of data. Besides, there were limitations from the teachable machine. Auto-adjusting the sample size made the microprogression image 10 times smaller and affect model training effectiveness. Our study found that the naked eye could automatically filter out image brightness and other details unrelated to pressure injuries. So, pride category recording to pressure injury feature. However, the new image generated by image pixel subtraction was not able to achieve feature categorization, which affect model training ability. In the future, more pressure injury images should be continuously collected to increase the data set size, and a more suitable method should be used to optimize the model training. In this study, majority of progression images were labeled as better, indicating that image record offers positive clinical benefit. By enhancing the awareness and pay more attention to the implementation of care, it is recommended that pressure injury image should be included in nursing records. The last section is the conclusion. This study preliminarily evaluates a predictive model for the early detection of microprogression pressure injuries. The model was established using an easy and programming-free AI modeling tool. The detection was performed independently by nurses without the assist of IT person. The tool had professional evaluation capability. Pressure injury image record can bring positive benefit to clinical care. This study was financially supported by the research funding for Far East Memorial Hospital. I want to thank my professor Jack Lee for his guidance, and thanks to the nursing assistants for our assistance in this study. This is the reference for this study. If you are interested in our research, welcome to contact us. Thanks for listening.